I'm Louise Beldon, born and raised in San Antonio, and always had a passion for, I guess, volunteering to help in the medical field has been one of the main areas that I've volunteered over the years. I was chair of the Nursing Advisory Council from 2004 to 2006, some of the early years of the NAC. Marie served afterwards, and then Greg Munster followed Marie. And I think each one of us had a different perspective of what the nursing school and the Nursing Advisory Council could do. And as the nursing school grew, our role grew and how we could help the nursing school. I was very involved in the Cancer Therapy and Research Center, which is now a part, at that point it was not a part of the UT Health system. It is now a part of the UT Health system. And I was president of the Cancer Center Council, which I think today is called the San Antonio Cancer Council. And through that, I started hearing about the nursing school, and I realized there what the role that nurses played. And at that time, Dr. Francisco Figueroa was president of the school, of the Health Science Center, and he always spoke about the role, how he was a cancer survivor, and the role that nurses played in his life. And then Phyllis Siegel had been involved in the actual development of the Nursing Council, and she asked me if I would join the Nursing Advisory Council, and I agreed to do it. So I think that was about 2001. In the early years when Dean Hawkins left, I was there for a short period of time while she was on. It was really in its infancy. Its job was to try to make the community aware of the nursing school. And Dean Hawkins had done an incredible job in developing a nursing school on this campus. But as we moved on, and we eventually got a development person that her job was the nursing school, and that was Carol Schwartz. And Carol really helped this NAC develop. She saw the ways that we could help. She was a nurse herself, and how we could help raise money for the nursing school, reach out in the community. And I've always said that a purpose of an advisory council like this is to be the eyes and ears in the community. So in 2004, when I became chair, I wanted us to educate our board so that if people in the community asked questions or wanted to know about the nursing school, we could answer them, or we could know where to reach into the community to help the nursing school. And one of the first things we did is we bought a mannequin. $35,000 we spent. We didn't have any money. And this was the first mannequin for the nurses to really work on rather than a human body. And then we started teaching the doctors how to, instead of punching into a person's arm, they were, or an orange, they were actually learning how to give shots in a mannequin. These were all early developments of how the nursing school could help. And I remember we had the nursing school had crank beds, these little beds that you would crank up. They weren't what the nurse students were going to see in a hospital. They were very old, and they weren't the push buttons that now the nurse. So we worked to help get the students some actual real beds that could help them be better students. And I think that these were ways that we could be of help to the nursing school.